all of a sudden there was this explosion of diseases in my patients. The CDC said that there were about 19 million new cases of sexually transmitted disease in the country, but it's all through the Bible that we are blessed by following His guidance.
There is a silent sexual health epidemic in America and the world, especially threatening to teenagers and young adults. But it is fixable. Today we're going to hear answers to what is the success sequence? How does sex relate to poverty? What is the unreported sexual health epidemic? We have answers and plans of action from founder and CEO of the 30-year Medical Institute for Sexual Health, Dr. Joe McIlhaney. Dr. McIlhaney, we're so glad you're here.
Thank you, Natalie. Thank you. I appreciate you having me.
Well,
because I like to get my message out. It's been on my heart for years, and thank you for giving me this opportunity to do that.
People think there's a problem, right?
Mm-hmm.
But I don't think we really even sort of scratch the surface of how difficult and how bad the problem is. And so I'm so glad that you're addressing it. And you were a obstetrician gynecologist.
Yeah, in Austin.
Working in practice.
Mm-hmm.
And what then made you lean to being founder and CEO of the Medical Institute for Sexual Health?
I think I saw God working in my life through this, with me not really wanting or even anticipating making a change. I was just a regular OB-GYN in Austin. Started practice there in 1968. And I was doing a good job. I had patients like me, and I liked them, so I loved what I was doing. But about 1980, all of a sudden there was this explosion of diseases in my patients that was just totally startling. For example, HPV, which is a cause of genital warts. And I began seeing these with so many of my young patients because HPV is a sexually transmitted disease. And kids were picking this up because of the change in the sexual climate that began really about 1960 with birth control pills, where been from 60 to about 80, young people began having this idea that they could have, they call it free sex, but and not have any problems from it. And now I was seeing them, they've been having sex the past few years, and with pre-cancer, the cervix from HPV, genital warts, and so forth. And then it was right at 1980 when we realized about the HIV epidemic. We didn't know what it was. But it was the beginning of the HIV epidemic with no treatment. So we were beginning, and I didn't have HIV patients in my practice, but they were all around. They were dying from these diseases, starting about 1980 also. 1982, the cover story of Time magazine was the new scarlet letter herpes. All of a sudden was just exploding everywhere. So, and I was seeing this with my patients. I remember a lady that came in who had sores on her vulva, and I examined her, and she had herpes. She was about 47, 48 years old, and she started screaming. The patients out in the waiting room could hear her screaming. He said he knew he had this disease. Well, it turns out that, and when he told me, well, her husband died about a year before. This guy had been a friend of them, and he talked her into having sex, and now he'd given her herpes, and it was just driving her nuts that she had this disease. So that's just one example of what I was getting to see in my practice all the time.
Also herpes, doesn't it? Is that the one that doesn't go away?
Yeah, when you get herpes, it's lifelong.
And then you have those
you have these sores that break out. And it's sort of like fever blisters of the vulva. But, and of course, if you do oral sex, you can pass the fever blister virus, which is also herpes type 2, to the vulva or penis. But yeah, once you get it, you have it the rest of your life. And of course, I'd have patients who would, matter of fact, just in the past year, there's a lady in my church who's about to get married, and she silently said, well, what if somebody you're going to marry has herpes? What do? I said, well, you go ahead and marry him. It's not going to kill you, and you know you will get it. And there are drugs and antivirals that can suppress it. So you'll be okay, but you'd rather not have it because you could give it to your child when you give birth, which I had happen with Steve and his wife. Baby almost died until they actually got it into the hospital, got treatment for it. So we're talking about these diseases that became very, very common, even as early as 1980, 1990. So my patients knew nothing about this, Natalie, and so I started doing some speaking and did some slides that showed the diseases of people's genitals, and people started asking me from all over the United States for copies of my slides, and I was on Dr. Dobson's program, Focus on the Family, a lot, and we talk about it there, and these people would start calling me. So I had a very busy practice. I'd helped start the in vitro, well, I'd start all the fertility stuff in Austin, laparoscopy, microsurgery, laparoscopic laser surgery, then IVF. And I was busy. And then I was getting calls from all over the country because it sounded like I was an expert on sexually transmitted disease. And so we started the Medical Institute for Sexual Health in 1992. And then by 1995, it was getting so busy, so many requests for our materials and our information that my wife and I prayed a lot. And so we just walked away from my medical practice. Yeah. But also we've been able to spread a lot of information, Natalie, but still people just don't know. About 4 years ago, we were saying from the CDC, the CDC is the nation's health clinic, if you will. It's the group in the country that does the research that everybody relies on. CDC said that there were about 19 million new cases of sexually transmitted disease in the country. Just a couple of years ago, the CDC started saying there are 26 million new cases of STD in the country. Last year, 26 million.
Last year, in the United States alone,
yep,
there were new infections. That's not people that have already had it.
That's not the people that have herpes that'll have it for the rest of their lives. But this is new infections with people that haven't had herpes or haven't had HPV. One of the problems is a lot of your audience, a lot of people listen to us, are good parents and they're raising their kids well and they're guiding them about what is God's plan for sexuality and for marriage. And so a lot of them don't get this, but a lot of people that don't have parents that are Christians or parents that are giving them good guidance about their sexual involvement, they're getting this stuff, a lot of them, around our good kids, if you want to say that. And of course, some of the kids that seem like they're doing well are getting involved in stuff that parents don't know sometimes. It's just everywhere, it really is. They're really suffering from this a lot. And the middle income population that's not Christians and not guided by what Scripture says are suffering a lot from this too. My work was in fertility care. And when back then there weren't reproductive endocrinologists, I was sort of that guy in Austin that was doing the reproductive medicine. It's heartbreaking for people that want to have a child and can't get pregnant on their own. A lot of them will adopt, but still it's really a heartbreaking thing for this woman I'm thinking about. My point is that people will just do almost anything to try to get pregnant. Back in the days that I'm talking about with the start of that IVF program about 1985, along in there, the most common reason for infertility, if the woman was the infertile part of the couple, the most common reason to be infertile was because of sexually transmitted disease. Chlamydia she'd picked up back in high school or college and now couldn't get pregnant as a married woman who's been trying 3 or 4 years and still can't get pregnant. Today it's the second most common reason for infertility.
Wow.
Is chlamydia.
And that is something you don't even know you have it. So in other words, people
That's
think
right.
you know, it's perfectly fine and perfectly normal to have sex with all kinds of different people before you get married, or at least some people do. And what you're saying is you get sexually transmitted diseases that people don't even talk about. Is that the unreported sexual health epidemic today?
Our organization, our work, my personal angst or pain for my patients started with sexually transmitted disease. But the real epidemic is kids who have chosen to cohabit instead of get married. And there are more kids cohabiting with their first living experience than there are getting married. That's the real epidemic, because then that is what results in so many problems, both for people individually and for society in general. But it's that pattern that young people get into. Let's just have sex, and then, well, let's just live together, and then that results in a lot of things we can talk about. So that's where we've come with our work, is say, yeah, sexually transmitted disease gets people's attention. It should, because it's horrible what's happening to people. The basic problem is this attitude about sexuality. And what's happened is people doing what they think is right in their own eyes, and that is just go to bed with whenever they feel like they love someone or just want to.
Compare sort of the world's value to God's plan.
Well, that's wonderful. I'm glad you asked that, because may I be personal about this?
Sure.
Okay. Well, my wife died of Alzheimer's 6 years ago. My first wife, I'm going to put it that way. A lady moved into this retirement home where I had my wife with her husband with Alzheimer's about 4 years after we had moved in there. My wife died 6 years ago of Alzheimer's. Then her husband died about 2 years ago of Alzheimer's. So we fell in love. And I'm 89, she's 88. And so we dealt with this sexual thing for us as single people. Then we got married, actually. Everyone told us we should go ahead and sleep together. And why not? Because you can't get pregnant, and who cares about people your age? We studied the scriptures about marriage. And it's not that, I'll just give you a summary, Natalie. It's not that God is trying to restrict our fun in what he says about marriage and about sex, but it's all through the Bible that we are blessed by following his guidance. And what he says about sex is for marriage, period, and don't do it unless you're married. Here's the problem for kids today. And that is that, and this is from research done by Mark Regnerus, a researcher at the University of Texas, a tenured professor there, who has shown that today the majority of young people, girls and boys both, feel like they have to have sex by the time they finish high school, or certainly by the time they finish college, to be normal. That if they don't do that, they are not normal. He calls it their script. The script they have in their brain is, I've got to have sex with this person if he wants to have sex, because otherwise I'm just not a normal person. And the worst thing in the world for a young person in the ages of high school or college is for people to think they're not normal. And there's incredible pressure. We have a black friend who has told us that in her high school, she was still a virgin. Her friends would gather around her and just berate her and kid her and make fun of her because she hadn't had sex until she finally did. So that's the world our kids are living in, and we don't know that's what it's like for them. Our goal in our work at the Medical Institute has become a project to change the American culture for kids, so that in 10 years, and we have a 10-year program we were working on, in 10 years the kids will say, I'm not going to have sex unless I'm married, period, and be supported by that by society around them.
Could you frame those problems in society today from sexual health? Because we're talking about them, but I don't think people understand this long list of other things that comes with it. And do we need to start first with what is the success sequence?
Oh, sure. I think that's a good place to start, Natalie.
Yes, I think so too.
Thanks for bringing that up.
And it's the positive angle.
There's a couple of researchers at Brookings Institute in D.C., and Ron Haskins and Isabel Sawhill
And they're secular, right? They're not, it's
Yeah,
not
Brookings
faith-based.
is secular, and
It's
they're
not
really sort
faith-based,
of
yeah.
liberal. They came up with the success sequence from their research. And it's really solid research. It's proven by many other studies now that if a kid will finish high school, get his degree from high school, get a full-time job, then get married, and then have his children in that order, in that sequence, only about 3 or 4% of them will end up in poverty. It's just dramatic, because if we look at our low-income parts of Dallas, for example, or Austin, or anywhere else, the poverty is rampant there. If those people had followed that success sequence, had finished high school, gotten a full-time job, gotten married, and have their kids, we would not have that poverty problem that we have in these big cities, period. It'd be taken care of. But it's a whole lot worse than that for the people that don't do that, Natalie. Because, for example, when kids have sex before they get married, and then they get married, they're more likely to divorce. So the idea of kicking the tires before you marry this guy, scientifically proven to be dangerous. Because when they do get married to that guy or somebody else, they're more likely to divorce. By that time, they often will have kids. So the ones that get married have kids, then the moms, it's almost always a mom left with a baby, or the ones that are cohabiting are more fragile. They're more likely to fall apart and have a child that's left with the mom. The problem is that the kids, first those families of single moms are more likely to be in poverty. The kids of those single moms are less likely to do well in school. They're more likely to have emotional problems, behavioral problems, and that just produces rampant problems. So we already talked about poverty that results from it, from this lack of marriage culture we're living in. We have educational problems with kids that are not doing well in school. We have behavior problems. And so, for example, as far as guys doing poorly, if you look at prison populations among the men, most of them don't have a father do not have a father in their home. I see these riots going on, and I see all these guys running around breaking through windows. I'm saying they didn't have dads. They needed dads. So I think if we could return to a real focus on the marriage culture, that a lot of these social problems we think are just intractable can be solved, including battered women. They're more likely, a woman's more likely to be battered in a cohabiting relationship than in a marriage.
That's what I've heard as well, but I feel like most people don't know, is there is a correlation with sex before marriage and fatherlessness. You know, you have the babies early and all that, with even, you were saying poverty, et cetera, but also I've heard it correlates with drug abuse, alcohol abuse, physical abuse, verbal abuse. I mean, just you go down the list, illiteracy, like you say,
That's right.
imprisonment. All these things are, are part of, and tragic. You know, when you think about battered women and child abuse and those kind of things. But there's a success sequence, and wouldn't you know, it matches the Bible.
It absolutely does.
Wouldn't it? Shock of all shocks.
Research, it's really common sense too, and it's also not. See, the Medical Institute from the start has been a scientific organization. We've never been a Christian or religious organization. We have been focused totally on reliable science all these years. But because we have pushed on the idea of marriage and pushed on the idea of not being involved sexually unless you're married, we're being accused of a religious organization. Well, we're not. We're just talking about what the research shows. And the research actually does show that the scriptures are right.
That's right. Well, and I know we're going to get into this, but and let's do it. So we've talked about those things. We can step into what the also unreported skyrocketing kind of highlight of the sexual health epidemic today, meaning the sexually transmitted diseases.
STDs, yeah.
People watch media, everything is telling you all these wonderful good things. You get the picture opposite of what's the reality.
Yeah, you're exactly right.
And so
I'll tell you what,
nobody tells you about these diseases that you're going to get and have for the rest of your life, and
that's right.
keep you from being able to have children and all these other kinds of problems.
Yeah, it's really an environment, a world that's unfair to particularly our girls. I wrote a book called Girls Uncovered. I wanted to call it Naked Girls because we've left them naked to basically what guys want to do with them. It is a problem for guys. Guys are more likely to be depressed if they've been involved sexually than if they haven't. But the people that really suffering are the girls. And we have left them unguided, unguarded in today's world. It's just, and it's not a fair environment for them because, like you say, everywhere in the media, everywhere on movies, everywhere in books, they're encouraged to believe that they can get involved sexually, that that's a normal thing and they can't get hurt.
And that's glamorized. Glamorized is the good, fun, and the guy's not going to like me.
Yeah, that's right.
Unless
And sometimes they do. A guy will leave a girl because she won't have sex with him.
And that's a
good riddance.
Exactly. We want to empower you girls out there. I know I was just talking with a lady who she tells her daughters that you do not want to, throw your pearls to swine, which is a verse, but you are, made in the image of God.
That's
you
right.
have dignity. You have worth.
Yeah.
You have value. And the guy is going to, want to physically do this. Don't throw yourself away.
Yeah.
In a sense.
That's right.
And you don't need to. You can wait for the person who really cares for you.
So important. We are made in the image of God. Girl, you're made in the image of God. You're valuable. You do not want to give yourself away cheaply like that. Matter of fact, you don't want to do that unless you're married. As far as STD, that's horrible. But it's almost, to me now, with the depression and suicide ideation that our kids are going through, that's almost, to me, worse. Over 50% of girls that are high school age, I'm thinking about that research report on them, over 50% of them are depressed to the point that for 2 weeks of the last year, it interfered with their behavior, with their activities, and what they wanted to do. I mean, we're talking real depression.
50%?
But we just, over half of them are. A third of them have thought about suicide, and about 10% have tried. Well, we just a month ago, were able to dig into the CDC research. It's called the Youth Risk Behavior Survey, that showed this much depression. Matter of fact, they just came out with the newest version. The numbers are almost exactly the same. But what we began wanting to know is, well, what would it say about sexual behavior? And so they actually had the data in there for us to dig out. Nobody's reported on this, nobody.
Really?
And so what we found was that the girls that had had sexual involvement were like 70% likely to be depressed. The ones that hadn't, only about 30% were depressed. But as far as suicide, the ones that had actually tried suicide, ending up in a doctor's office or an emergency room, the ones that had sex were 5 times more likely to have done that than the ones that hadn't had sex. So it's not the only reason kids are depressed, but it certainly seems to be one major reason we're seeing depression among our young people today, is this whole sexual thing. Related to this, and we don't really have good data about this yet, is kids that have questions about their gender. So we have kids that they get involved in sex, they're depressed in part because of that. We know that now. Kids are questioning whether they're a girl or a boy, and they're depressed because of that. These people think I'm a tomboy, so I must be a boy. Well, that's depressing not to even know if you're a girl or a boy. So this whole world kids are living in is a depressing world. It's really, I said earlier, it's unfair to them to lay this world out for them like that. So that's the work I'm totally committed to. I think it's horrible the way this is happening with our kids, and we want to do something about it. That's what my whole commitment to this is. 89 years old, and God won't let go of me. But until He releases me, I'm going to be available to try to do something creative to try to change this for kids.
I believe there's a whole lot of lies when you wrap around that depression and the suicide attempts of of people that are having sex before they're married. I believe there's a huge lie out there.
I agree.
That this is going to make you happier. This is going to make, and instead it's actually the opposite, because, well, being a Christian organization, being a Christian, it's just not in alignment with what God wanted for you. He wants the best for you. His rules are not like something He wants to bully you into.
No, or take away our fun.
No, it says 8 times in the Bible at least, I give you these commands so that may go well with you,
right.
so that you may have joy. And Jesus said, I give you these commands so you may have joy, and that your joy may be complete or full. I mean,
that's exactly right.
He's
and
really,
that's what you and I want for our kids. And that's what our Christian parents want for our kids. The parents that aren't Christian, I think, and even Christian parents, I think, are really questioning their teaching kids just what you said, that sex is really for marriage. Because I think they're, especially ones that aren't Christian, but the ones that are Christian, I think still are saying, well, is this too restrictive? Is it really too legalistic?
Because the culture is so much pressure and teaching so differently.
Exactly. Not just on the kids, but on the parents too. And so parents are sort of mixed up about what they ought to be teaching their kids. And I think the research, the data, like I said before, we're a scientific organization. We're not trying to pull out of the Bible things that we want to say, but we're just trying to say, here's what the science says. And we want to reinforce parents to know that the message they need to teach their kids is you don't have sex unless you're married.
And that is what scientifically shows huge benefits in emotions, right? In physically not having these sexually transmitted diseases, which we need to get into more deeply. People don't even realize how debilitating that's going to be for you, and how it really doesn't take too many partners to have that, right? You can have one boyfriend, then another boyfriend, and because they've had another boyfriend, you just...
That's exactly right.
Right.
We've seen some diagrams that show this one person's had sex with this one person. That person's had sex with 2 or 3 others. We don't push this chart out on people, but it really shows that you've had sex with all these people. And in one sense, as far as the diseases you have,
that's
herpes with this one up here 3 times ago.
I hadn't thought about it that way, but you've had sex with all these people that you're...
Herpes is very communicable. HPV is. About 20% of all Americans have herpes, and once they have it for their whole life long. About half of Americans have HPV at some time because there's so much sexual mixing going on.